Looking at this internal anatomy picture, we're going to begin our discussion of kidney function by kind of skipping over some of the most important stuff and get right to the end where urine is produced. Then we'll double back and learn about how that urine got produced by a nephron. So you'll notice in this drawing we're showing just a single nephron, but there would be many more uh, positioned very similarly to this one. And each of those million nephrons get their blood flow from an afferent arteriole. And as a result of nephron function, urine is produced. So we're going to kind of skip that nephron function and get right to urine. You'll notice that the last part of this little nephron is known as a collecting duct, then papillary duct. And the papillary ducts are right at the little point of the renal pyramid. So you can imagine there's a bunch of little papillary ducts all dripping urine into this structure here, which collects the urine. That structure is known as a minor calyx. Each renal pyramid has a minor calyx, collecting all the urine from the nephrons located within that pyramid. You'll notice then, as that urine gets collected, where there's many minor calyxes merging together, that's often referred to as a major calyx. And then eventually, where all urine has to go before it leaves a kidney is known as the renal pelvis. And as that urine accumulates, the pressure that forms moves that urine out of the kidney into the ureter. And then the ureter travels down to the urinary bladder, where it can be stored. The urinary bladder can store quite a bit of urine. Usually I say about 800 milliliters. Then, even before that, you get the urgency to urinate. But urination actually requires parasympathetic stimulation of the urinary bladder, and that will excrete the urine out the urethra. So this is kind of this initial travel of urine after it was produced by a nephron until it eventually goes down to be stored at the urinary bladder. Here is our drawing of a urinary bladder. It is an anterior view of a frontal section of a female urinary bladder. Couple things to note. One, you have the two ureters coming down from kidneys and attaching to the back of the urinary bladder. So in the back of the urinary bladder, you can identify the ureteral openings, two openings from the ureters. There's kind of a connect the dots here showing what's called the trigone. The trigone is basically like a little trough that helps guide that urine down towards the internal urethral orifice. That's where that urine eventually has to leave the bladder through the urethra and out the external urethral orifice. You'll notice the inside surface of the bladder contains rugae, much like the inside of a stomach. That allows that urinary bladder to expand as it fills with urine. We also see that the muscle, the smooth muscle of the bladder, has a name. It's called the detrusor muscle, and it's going to be stimulated by parasympathetic nerve impulses that come from the sacral spinal cord. So there are nerves that come down off the bottom of the spinal cord that go to the bladder and stimulate urination. When urination is triggered, it can be controlled by sphincters. There's an internal urethral sphincter, which is involuntary. It's going to open that internal urethral orifice and allow urine to flow. We do have conscious control, luckily, of urination, and that is done using the external urethral sphincter. The external urethral sphincter is skeletal muscle that you can voluntarily open and close. So you can voluntarily open it if you decide to urinate maybe before a long trip and you want to empty your bladder. Or you can voluntarily keep it closed in order to postpone urination. So this is some of the anatomy of a bladder, a little bit of the control of the bladder, but it's largely parasympathetic. And we often refer to urination as voiding, or the nervous system control is called the micturition reflex. But you'll notice here, when empty, the urinary bladder looks kind of like a deflated balloon. As it fills, it becomes round, then kind of pear-shaped, and it holds on average 700 to 800 milliliters. But you'll know way before that it's almost time to get ready to find a place to urinate. The urethra is the tube that allows urine to pass from the bladder out of the body. These are a couple drawings we're going to look at a lot when we get to the reproductive systems. But for now, it's just to show you the difference in the urethra of a male compared to the urethra of a female. So the biggest difference is that the urethra in a male is much longer, and it's divided into 3 segments. So in a male, the urethra has to go through the prostate gland. So that region of the urethra is called the prostatic urethra. Then before it gets to the penis, there's a region called the intermediate urethra. Then when it runs the length of the penis, it's known as the spongy urethra. So male urethra, much longer, divided into 3 regions. When you compare it to the female urethra, which is much shorter. You'll also notice the volume is different. Female's bladder is a little bit smaller. It also has a uterus on top of it, and we'll talk about that when we get to the female reproductive system. The other difference is the male urethra is used for both the urinary system, elimination of urine, but also the reproductive system, ejaculation of semen. So male urethras are part of both the urinary and reproductive system, whereas in females it's only part of the urinary system. The next video we're going to start to look at a nephron and its structure. And the best way to learn a nephron is to draw it. So we're probably going to do that in class. We're going to get a piece of paper out and draw it ourselves. But in the next video, I'm going to walk through the structure of a nephron using this picture.